Depression is a common and serious mood disorder that affects nearly 1 in 5 adults or 19 million people in the United States. For these patients, the appropriate treatment may be life-saving. Yet half of patients with depression will fail to respond to their first prescribed medication, leading patients on a medication odyssey of trial and error treatments that can last for years. Here with more is Dr. Michael Genovese. Good morning. Great to have you on the show.
Thanks for having me, Stephanie.
So I've seen this happen far too often with people and loved ones around me, but first talk to us about how big of a problem depression actually is.
Well, it's a really big problem. As you mentioned, the numbers are staggering when you think about it. And one of the other things that you mentioned is also really interesting. Half of the people who try to get help for this disease are not helped the first time they take a medication. And then they do go down this path of what is sort of a subjective choice of medication after medication. The good news is that now we have a scientifically based, objective way of choosing the right medication for our patients.
And how are they doing that? How can we avoid this trial and error odyssey?
Well, we can look at your genes now. There's a test called GeneSight, and by collecting some of your DNA, I can look at your DNA and I can tell you which medications you're more likely to benefit from and which medications you're more likely to have side effects to based upon your own individual genes. I mean, this is truly personalized medicine, and it's really revolutionized the way we treat depression.
That's incredible. Is this testing that's good for any patient or anyone in particular that this can help, or anybody dealing with depression?
Well, I think that everybody who's dealing with depression, since it is such a difficult disease to treat, everybody that's dealing with it should be speaking to their doctor about this test, because if you think about it in any disease state, if you go to see your cardiologist, they're going to run tests to optimize your treatment because they want you to get better as soon as you can. We should be doing the same thing for our patients with depression. I mean, you mentioned that you'd seen your loved ones and friends go through this, and you know how devastating this can be. Depression can cause low mood, inability to experience joy, trouble with concentration. In worst cases, it can result in death. So it really deserves our best efforts.
Yeah, certainly something that can, take over your life. It's tough to live a daily life when dealing with something like this. Now, is this treatment something that can be done in the doctor's office, or if some of our viewers are listening, right now and want to take advantage of it, what should they be doing?
Absolutely. Yeah, it's done right in the office. It's easy to collect. It's just a cheek swab, so it's non-invasive and there's no pain. We get the results back pretty quickly in about 36 hours. And then what I do is I sit down with the patient, because I think patient education is extremely important, and we review the test together. And what's great about the GeneSight test is it gives me as a physician a lot of information. And it's also easy for the patient to understand, because the report is laid out in a stoplight analogy with a red, a yellow, and a green column. And I tell the patient we're going to avoid the medications in the red column, and we're going to try to use the medications in the green column that marry up with your particular DNA. And that's the way that we're able to find the right medicine for the right person.
Dr. Genovese, thank you so much for taking time to share this new technology. Life-saving, it sounds like, technology. Anywhere you can send us online to learn more if our viewers have any questions?
Yeah, absolutely. I think you should check out genesight.com, and there's a lot of really good information there, and you can look at that, and then you can take some of that information and then go talk to your doctor about it.
Thank you so much for joining us today. If you'd like more on what Dr. Genovese spoke about or GeneSight testing, head online. Check out our website. We'll have this interview posted at fox4morningblend.com.